Hi. Today what I'd like to discuss is what qualifies me to help you with your diabetes. So many people don't know that when a chiropractor graduates from school, they basically have the same education or very similar education to a medical degree. And as chiropractic graduates, we are able to treat virtually any condition, including diabetes, high blood pressure, etc. Now, in my clinic, when I'm working with patients, I always have the patients continue to see their medical doctor, and their medical doctor determines what's done with their medication. I never take patients off their medication. I often work with them until they're ready to get off their medicine and then send them to their medical doctor for an evaluation and for a discussion. So first thing is, we are qualified as graduates of chiropractic school to treat people with diabetes and to help people with diabetes. But secondly, I've done a lot of graduate training in neurology and have done all the training necessary to sit the board as a chiropractic neurologist, to sit the board exam as a chiropractic neurologist. I also have done advanced training in nutrition and have a certificate as a certified digestive specialist. So my training in nutrition and digestion and in neurology is what helped me figure out what to do for people with diabetes. But now the other thing that really is important, the reason that I'm able and have decided to move into this area, is that I began working with diabetics almost 15 years ago, and here's what I noticed. And by the way, I have now worked with over 1,000 diabetics. So here's what I've noticed in working with them. Most of them, if they come to my office when they've only been diabetic 6 months or a year, they're usually on one medication at a very small dose. When they come to me after being diabetic for 5 or 6 years, they're usually on one diabetes medication at the full dose and a second medication at a smaller dose. And they're usually on also blood pressure medicine or cholesterol medication by this time. And then frequently when people come to me who've been diabetic for 10 to 15 years, they're often on 2 diabetes medicines at the full dose, sometimes a third medication, sometimes insulin. They're on 2 to 4 and sometimes even 5 blood pressure medications. They're on cholesterol medication. They're often on medication for their digestive system because they're having digestive and stress difficulties with their digestive tract. They're often on medication for neuropathy. They're often on medication to protect their heart or their kidneys. And so it's not unusual to have a patient come to see me on 7 to 10 medications, and I've had people on way more than that. So the fact of the matter is that if a person can control their blood sugar with one medication early on, and then 10 to 15 years later they're on 10 medications, that tells me that they're getting worse and worse under care. So the expected outcome for patients is that they get worse and worse and worse while they're being treated for diabetes. When patients work with me, and they do continue to work with their medical doctors while they're working with me, we are usually able to get their blood sugar, blood pressure, and cholesterol under much better control, and the doctors are often able to reduce drastically, or even in most cases, or in many cases, totally eliminate their medications. So the fact of the matter is that with the right care, people get better. And if they don't get the right care, they slowly get worse and worse and worse. So in our next vlog, we'll talk about why is it that people get worse and worse and worse under care. That's all for today. Thank you.
I think that was the